Senator Hassan.
Well, thank you, Mr. Chairman and Ranking Member Murray, for your work to address rising health care costs. I also want to give a special thank you to your staffs. These are complex issues, lots of stakeholders, and therefore lots of incoming for your staffs, and they've just been terrific. Americans have called on Congress to act, and I applaud members of this committee and both sides of the aisle for taking these calls seriously. I'm particularly encouraged by the momentum behind our work to end the absurd practice of surprise medical bills. People get health insurance precisely so they won't be surprised by health care bills. So it is completely unacceptable that people do everything that they're supposed to do to ensure that their care is in their insurance network and then still end up with large unexpected bills from an out-of-network provider. As has been mentioned, I've been working with Senator Cassidy, Murkowski, and others to address this issue in a bipartisan way. We've worked for over a year now on this issue and received and incorporated feedback from many of you on this panel, and I'm very grateful for your testimony. And this hearing is an important step forward as we work to protect consumers and end surprise medical billing. Mr. Kavanaugh, I'd like to start with a question to you. My colleagues and I in our bipartisan working group agree that patients must be removed from surprise billing disputes, but it has become clear that there's no benchmark payment rate that plans and providers can agree would be an appropriate one-size-fits-all approach. During your time at CMS, you experienced firsthand how difficult it is to set uniform payment rates that work well throughout the country. Can you briefly touch on why that work was so challenging?
Sure. Thank you, Senator. Again, if you think about the Medicare Advantage, which is an analogy, in Medicare Advantage, if you go out of network, there is limits on balance billing, and there's a set rate that the provider will be paid because it's a highly regulated system. But that's built on an enormous infrastructure of the Medicare fee-for-service program that takes thousands of employees in Baltimore working every day. So there's an infrastructure. It's been refined over time. It's not perfect, but it's built on something. If you were to go the benchmark route in this legislation, I should preface this with saying Alidate doesn't, we support all three approaches because you're protecting the consumer.
Understood.
We don't have a preference for that after that. But I do think, and the legislation tries to anticipate, you will run into, as you try to, a benchmark rate is essentially rate setting of a sort.
Right.
And you will run into unanticipated consequences, and someone's going to need to figure out how to adjudicate all those situations and make sure you, because you're not building on the Medicare fee schedule, which has a whole agency administering it. You're starting from scratch.
And briefly, is it fair to say that even when you do establish a benchmark, a rate, it's hard to maintain that as an applicable rate across the country for all providers?
I think what you're getting is I do think there's some unanticipated consequences from this that will all, if you decide to go that way, that we would all learn. It will take more work than any of us can anticipate, but it is one of the approaches.
Yes, thank you. Mr. Nichols, we've heard a lot of disagreement throughout this process on how to best create a payment resolution that works for all parties. So yes or no, based on your experience, do you believe that there is a benchmark rate that you and your colleagues in the provider and payer community could agree to, which Congress could then legislate into federal law and apply across the country?
We do not.
Given the lack of consensus around what a correct benchmark payment rate would look like, it seems unwise to me for Congress to legislate an inflexible benchmark, especially when we know that if we get it wrong, it would take another act of Congress to undo it. Do you believe an independent dispute resolution framework similar to what's already in place or in law in 12 states would be workable for hospitals, providers, and payers, and why or why not?
Okay, I believe, as I mentioned, of the three options in the bill, that is the most preferable option. We would prefer to continue negotiating with our insurance colleagues for bills, and we would like to do that. I think particularly for physicians, particularly for the rural physicians, going back to Senator Collins' question, that a dispute resolution system, much like in New York State, which has proved effective, efficient, et cetera, would be the best option that is in the bill.
Thank you very much. I yield the remainder of my time.
Thank you, Senator Hassan.